Hi everyone, this video is part 2 of the unit on clinical psychology, and this particular video will cover anxiety disorders and related illnesses. So to begin with, anxiety is something that everyone has felt at some point in their life. Anxiety is a result of the sympathetic nervous system activating to some kind of fight or flight situation. So there typically are common feelings that people have biologically when their sympathetic nervous system is triggered. Usually it's to some kind of threatening situation. So obviously we're not always being chased by a bear when we feel anxiety, but if you can imagine being chased by a bear, the biological arousal that happens would be things like your heart racing or your body beginning to sweat. You might feel tense inside. Your breathing will probably increase. Those are all results of your sympathetic nervous system activating, and these are the similar feelings that you feel when you have anxiety. And so anxiety is a word that we use just often in our life when we're feeling nervous, stressed, worried, tense. Those are all related feelings. So most people have an understanding of what that feels like, but an anxiety disorder would be when these persistent feelings of anxiety, you're not having any kind of relief from them, and they're long lasting, they're enduring, they're uncontrollable, and maybe they're even difficult to explain the causes. And so with an anxiety disorder, this is when a normal function has become persistent and is reaching the point of abnormal. And so anxiety disorders are actually a very common mental illness. Anxiety disorders are the most common mental illness in the United States. And according to the National Institute of Mental Health, 31% of Americans will feel the effects of anxiety disorders at some point in their life. So it is something that most people are familiar with, especially knowing what anxiety feels like. Just generally, people tend to connect with this. And so I want to make sure you understand where this information is coming from. Anxiety disorders are defined in the DSM, and I covered this in the previous video. The DSM is the Diagnostic Statistical Manual of Mental Disorders, and they're on the 5th edition right now. The DSM is, just as a review, is that book that defines mental illnesses, and it does not give any treatment methods. It just gives the titles of illnesses and the symptoms so that a doctor or a medical professional can identify the illness by the symptoms. So when a patient is describing their symptoms, the doctor or the psychiatrist or the psychologist will record the symptoms and then match them with a disorder to give them a label for that. And then they're able to then, after they're diagnosed, then the doctor is able to prescribe them either medication or some kind of treatment method based on their perspective and their approach to treatment. So let's start with the disorders that you need to know for this unit. So for AP Psychology, it's important that you just know some of the general disorders that are related to anxiety. Now, some of these fall in some other categories like trauma and stress related disorders or obsessive compulsive related disorders in the DSM, but together we're going to lump them with anxiety. So all of these have some kind of anxiety component to them, and this isn't an exhaustive list. There are many disorders that we are not covering that are outlined in the DSM, but these are some of the common and disorders that you need to know for AP Psychology. So to start with is Generalized Anxiety Disorder, or GAD. And Generalized Anxiety Disorder is a great title for this illness because it is what it sounds like. It's a general, unexplained feeling of anxiety that's just persistent and it's kind of pervasive across different areas. So it ranges into many areas of life. So a person who has generalized anxiety disorder is going to find it really difficult to control their feelings of nervousness and worry. They're going to really feel this excessive stress that's going to last 6 months or more. And in order to be considered generalized anxiety disorder, it needs to cross over into a range of activities in their life. So from work to school, finances, friends, family, it needs to cross over into a range of different activities in their life. They also have to have 3 of the 6 following characteristics. So they have to have 3 of these. So the 6 other symptoms would be feeling restless or on edge, feeling easily fatigued, having a difficult time concentrating, feeling really irritable or having muscle tension or sleep disturbances. And so those are all these kind of biological results of this excessive stress. And so they would have to have 3 of those 6 other factors to be considered generalized anxiety disorder. The next disorder is panic attack and panic disorder. So I should rephrase that. Panic attacks aren't disorders themselves, they're symptoms. And so someone could have a panic attack and not have a specific disorder. A panic attack is just a symptom. And someone could have panic attacks alongside other anxiety disorders. So let's define panic attack first. A panic attack is an episode, so it's a one-time a situation. It's a surge of intense fear, terror, dread. Typically, it has an overwhelming biological sensation that happens alongside of this intense fear. People describe the biological feelings that come with this or biological factors as feeling like a choking sensation or difficulty breathing and shortness of breath, a tightness in their chest, or even a feeling of nausea. And so that would be a panic attack. A panic disorder would be given, a diagnosis given to someone who is having reoccurring panic attacks. And so this would be if someone is having spontaneous panic attacks, but reoccurring panic attacks that are happening on a kind of consistent basis. So panic disorder would be where someone is having these reoccurring episodes. Next are phobias. Phobias are often disorders that students are familiar with. A lot of times phobias are used in the media or in common language. People are familiar with this. A phobia is a fear. Oftentimes, though, what the media or movies or things get wrong is that phobias are fears that are inhibiting people's life, their daily routine. It's changing their way of life, and they're avoiding this fear that they have at all costs so that they can maintain a level of comfort. And so a phobia is an intense dread. It could focus on an object or a situation, depending on if it is a social phobia or a specific phobia. A social phobia actually has a more specific name. A social phobia that has to do with a fear of a social situation is called social anxiety disorder. This would be a fear of social settings. There's all different kinds of social settings that people might have anxiety towards, whether that's public speaking, whether that's eating or drinking in public, or having some kind of social contact. Those would be social anxiety disorders, and a person would try to avoid this social situation at all costs. A specific phobia would be a phobia or a fear of an object or a situation, not necessarily related to a social situation. That would be social anxiety disorder. But a specific phobia would be on something more specific, an animal, elevators, heights, airplanes, and there's all different kinds of specific phobias, and each have their own characteristic name. But something that is really important to understand about phobias is that this is going to change the person's lifestyle. If someone has a phobia of dogs, they're going to avoid parks, going on walks. They might take different ways to work or school. They might not go to gatherings if they're afraid that there's a possibility that animal might be there. And it's going to affect their life and cause extreme anxiety. And many times people will see it as irrational. To others, it will seem irrational, but to that person, it's very, very real. Next is agoraphobia, and this is a more specific social phobia. Agoraphobia has kind of a unique piece to it, so that's why it's separate from social anxiety disorder. Agoraphobia is when someone has an anxiety about a social situation, but not just the social situation. It's coupled with having this fear that when they get into that social situation, they won't be able to escape it. And so it's this overwhelming dread that being in this social situation that they're afraid of, they'll be trapped there. And so what will happen is at all costs, they will avoid that social situation. So not only are they afraid and have anxiety and fear over that social setting, they also have this crippling feeling that they'll be stuck in that social situation when they get there and they won't be able to escape. The next is post-traumatic stress disorder. And post-traumatic stress disorder is kind of in its own category. It's related, it's a trauma-related disorder and a stress-related disorder, but it is, in this PowerPoint, I've put with anxiety disorders because it has an anxiety component to it. Post-traumatic stress disorder, or PTSD, is a disorder that is a result of extreme trauma. And extreme is relative to the person. So to one person, it could be witnessing a crime, or to another person, it could be being the victim of the crime. And it could be a range of things. Veterans of war often come home and struggle with the trauma that they witnessed. It could be serious car accidents or natural disasters or human disasters, witnessing an illness of a loved one. There's really not a limit to what post-traumatic stress disorder can encompass as long as it was traumatic for that person. And post-traumatic stress disorder has symptoms, and those symptoms are that this person will continue after that event, continue to have persistent distress and unwanted intrusive memories of that event, whether it comes through dreams or waves of thoughts. Often they will want to avoid sounds or sights or anything that could trigger that memory to reoccur. So post-traumatic stress disorder is linked to a trauma, and that trauma results in symptoms of stress and intrusive memories and unwanted anxiety that's persistent and long-lasting. Obsessive compulsive disorder is one that's often confused with a personality trait of being rigid and orderly. Obsessive compulsive disorder is not a personality trait. Obsessive compulsive disorder is when a person has intrusive and unwanted thoughts and urges. Those are the obsessions. They are these intrusive thoughts that are relentless, and it is a haunting feeling that the person cannot overcome these thoughts. That these thoughts oftentimes are preoccupations with maybe a horrible event of death or illness that could be looming, or the possibility of bacteria and dirt and germs, and they are preoccupied with that intrusive thought, and that intrusive thought pushes them to perform repetitive behaviors or mental tasks. And those repetitive behaviors and rituals and checking and washing and those tasks or behaviors are carried out to reduce that anxiety of those intrusive thoughts. Next is trichotillomania, which is an anxiety disorder that is a compulsive hair pulling behavior, which is just a result of the anxiety and stress a person is feeling, and they're driven to pull their hair in different parts of their body, which often can lead to balding or even the inability to grow hair in those places. Lastly, we have body dysmorphic disorder, or BDD. And body dysmorphic disorder is when someone has a perceived defect or they believe there's a flaw in their physical appearance. It's typically focused on a body part, and often they will want to hide or conceal that body part. They'll be very focused on that body part. It might even lead them to want to get cosmetic surgery to remove or to alter that body part. Well, that's it, guys. I hope it was helpful.